Just imagine, you are lying on an operation table in the year 1800. Doctor pick up a knife. No anesthesia, no painkiller, no sedation. बस 4-5 लोग तुम्हें पकड़ते हैं और सर्जरी शुरू हो जाती है. Your scream echoed through the hospital. Some patient actually died, not because of the surgery, but because of the pain itself. So how did humanity go from unimaginable pain to painless surgery? This is the incredible and surprisingly controversial history of anesthesia. So before anesthesia, in 1846, surgery was literally a race against time. The faster the surgeon, the greater the chance of the patient to be survived. Some famous surgeon could puncture the leg under 30 seconds. Not because they were showing off, because every extra second meant more pain, more blood loss, and a higher chance of death. Patients were often tied to the table. Some were given alcohol, some opium, or others were simply told to bite on the leather shaft. And yes, many people preferred dying from disease rather than going through surgery. Strange now. Humans desperately searched for the way to eliminate the pain. Ancient Egyptians used opium. Chinese physician Hua Tao reportedly used herbal anesthesia called Ma Fi San nearly 1800 years ago. People even tried hypnosis, ice, compression of nerves, and some completely bizarre herbal mixture, but none were reliable enough for major surgery. Then comes to laughing gas. Nitrous oxide. In the early 1800s, people inhaled it for entertainment because it made them laugh uncontrollably. Hence the name laughing gas. One day, a dentist, Horace Wells, noticed something unusual. A man injured his leg while under laughing gas, but he didn't feel pain. Well, though, what if this works during tooth extraction? Because he was a dentist. He tested it on himself. It worked. But during a public demonstration, the patient screamed. People assumed anesthesia was fake. His career collapsed. Sadly, Horace Wells never lived to see how important his discovery would become. Ether changed everything. Then comes October 16, 1846, a day now known as Ether Day. Dentist William T.G. Morton demonstrated ether anesthesia in a general hospital. The patient remained almost completely pain-free during surgery. After the operation, the surgeon reportedly says, "Gentlemen, this is no humbug. Medicine has changed forever." This single event is considered one of the greatest breakthroughs in the medical history. Soon another anesthesia appeared, chloroform. It worked faster than ether. Scottish physician James Young Simpson introduced it in the childbirth, but many people opposed it. Some believe pain during childbirth was natural and should not be removed. Everything changed when the Queen Victoria used chloroform during the birth of Prince Leopold in 1853. Once the Queen accepted it, public opinion changed almost overnight. Today, anesthesia is much more advanced. More anesthesiologists don't simply make patients sleep, they carefully control pain, consciousness, muscle relaxation, breathing, blood pressure, and heart rate. Throughout surgery, every vital sign is continuously monitored. That's why modern anesthesia is considered one of the safest fields in medicine, although no medical procedure is completely risk-free. The next time someone says it's just anesthesia, remember, behind the tiny injection lies nearly 200 years of experiment, features, controversies, and courage. It transformed surgery and saved millions of lives. Because sometimes the greatest medical discovery isn't the surgery itself, it's making sure you never feel it. If you want to know more about these things, Then subscribe to Frozen Pine, like, comment and share.